I'm Linda Templeman, CEO of Persista Bio. At Persista, we envision a future where chronic diseases are effectively cured with long-term allogeneic off-the-shelf cell implants, and we're focusing initially on type 1 diabetes. Maybe you know someone with type 1 diabetes. Most people with type 1 diabetes are doing constant monitoring, constant injections, frequent hospital trips, and they have the debilitating long-term side effects of diabetes, such as vision loss, amputation, and kidney disease. It's a very serious disease, and it really impacts people in their lifestyle and in their long-term health. So on the left, today's continuous glucose monitors and sensors have gotten better, but they're still hard to use, and they still give suboptimal glucose control. You can see the wavy line. However, in the center, there's something called islet transplantation. That has a much better outcome, much better glucose levels. However, it's not optimal because you need donor tissue, which is scarce, and the patient has to take lifelong immunosuppression. So 95% of type 1 diabetics are not eligible for that type of treatment. Now, what we're trying to do is we're trying to get the benefit of islet transplantation, but without needing immunotherapy. So we have a groundbreaking encapsulation technology. Our fully implantable system protects therapeutic cells from the immune system while still letting them secrete insulin into the bloodstream to control glucose. The oxygenated system allows the cells to thrive long-term without the immunosuppression drugs I mentioned. This system is basically a mini organ that significantly enhances viability and function, and the vast majority of type 1 diabetics can take this, and they will be able to eat and live as if they don't have the disease. There have been a number of major breakthroughs in stem cells, an infinite supply of cells for type 1 diabetes. So we see here that there's a number of companies that are working in this space. The cells are working. However, the cell therapy portion, the portion that holds the cells in the body, has not been working for people. So they still require immune suppression. And again, only about 5% of the people can take these cells. The major competitor systems don't provide oxygenation, which we believe is necessary for long-term cell life of these compact implants. And the recent implantation trials of some of these companies have not met their endpoints. The Persista biosystem is a subcutaneous encapsulated implant that does not require immune suppression drugs. Our cell capsule system generates oxygen internally in the body using an electrochemical system. This nutrient facilitates long life in a compact implant that functions like a mini pancreas. So here you see the idea for the human product. It will be compact, about the size of a credit card. It will be fully implantable with only periodic recharging of a wireless recharging of an implantable battery. And we think this device will cost less than $3,000 to produce. The flexible cell capsules shown there in blue can hold a high dose of cells, and they're supported by in situ oxygen generation, which uses water actually from the body. Our preclinical studies have already shown outstanding results. We've cured type 1 diabetes in the rat model, and we've just published that work in Nature Communications. It's a short presentation, but let me show you some of the seminal data. So basically, oxygenation, shown here in green, the green cells are the ones that had oxygenation while they were implanted, and you see they control blood glucose. On the left, the control without oxygenation, those cells do not live and they do not control the oxygenation. They don't have oxygenation and they don't control glucose. You'll see on the right, there's some red data, and our co-founder at Cornell, Mingling Ma, he's very, very accurate with his data, and those particular animals bit the external cord for these rat studies, and they lost their oxygen and the glucose level went up. And my collaborator is so honest that he shows the good and the bad and the ugly. So Persista will bring a curative cell therapy to market with a stem cell partner. You'll see in the last 5 years, there's been quite a few deals in this space. However, they've still not solved the cell implant problem. We think the space is right for Persista's unique solution with encapsulation to curatively treat the 2 million type 1 diabetics in the US. We're estimating that for the device alone, without the cells in it, and just for the type 1 diabetes market, this could be a $1 billion market for the hardware alone. So a little bit about our team. Everybody in the group has significant experience in commercialization and translation of technologies. So my first product came to market in 2010, and I led the company that developed the implantable oxygen generator, and I'm an inventor on that technology. We've already licensed Dr. Mingling Ma's technology from Cornell University in the encapsulation space. And then on our team right now is Dr. James Flanders, and he's a large animal veterinarian who's doing the large animal studies, the preclinical testing for this device. Importantly, our advisor is Dr. James Shapiro, and he is a leader in diabetes cell therapies and the islet transplantation technology I was telling you about. Basically, he dreams of the day that any patient that walks into his clinic can have a cell therapy without immune suppression. And Persista Bio is here to enable that dream. So great news at Persista Bio. We've just been awarded $2.4 million in SBIR grant funding. We will use this to start our large animal pig model. So we've done proof of concept in the rat. Now we'll do the proof of concept in a more accurate animal model, the pig. And we'll also be able to make some advances on the device. We'll do these studies at Cornell. We've just joined the Cornell Life Science Venture incubator there. So we're excited to work out of Cornell and do our large animal studies there. We're currently raising $3.5 million to accelerate the commercial readiness of this technology, including development of the fully implantable system, so everything is under the skin, and also to start manufacturing the components under GMP manufacturing conditions. Something else I'd like you to know is that beyond diabetes, this technology can be used for other long-term cell therapies, long-term implants. And we're thinking we could do things in the metabolic disorder space and in inflammation and chronic pain, anywhere you need to secrete a molecule into the body. All right, so imagine a future free from daily insulin injections, free from daily glucose monitoring, and the debilitating complications of diabetes. Persista's breakthrough encapsulation system can make that future a reality. I'm happy to take questions, and after this session, when we have a coffee break, happy to talk to anybody who's interested in this.
So I'm curious about the IP landscape. So you said you licensed from Dr. Ma, or Dr. Ma's inventions from Cornell. So where you're patenting the device itself? Are there also patents on the you were talking about encapsulation? Are there patents that cover that? Like once the therapeutic is within the body?
Yeah, so basically we're we're licensing both from Giener Inc. that holds patents on the oxygen generation system, and Cornell has more materials patents on the encapsulation and extra materials there. And the most recent patent filed at Cornell is somewhat of a combination of the two objects. So they are apparatus patents. We are not patenting anything in the cell space because right now we're not using a novel cell type ourselves. So once we partner with somebody, I imagine we again would go ahead and patent the combination of a particular stem cell variety with the encapsulation system and the oxygenation.
Okay.
Nice question. Thank you.
And the company that you mentioned, Giener Inc., is that the company that you said you were CEO of in a different?
Yes, I was CEO of Giener Life Sciences, the life science division of that, and that's where we developed the implantable oxygen generator. So
okay, but not related. Are they related companies?
Yes,
they are. Okay.
Giener Life Sciences was a short-term spin out of Giener Inc. while we were working just on this one project.
But now this company is a separate
entity. Yes.
Okay.
Great. So you mentioned that there's a wireless battery as part of the implant. Is that right?
Wireless recharging of battery. Yep.
Okay. I'm just curious, like, what do you think the estimated life of that battery is? Because it's being implanted.
Yeah, so the implantable batteries usually have about a 10-year life cycle, and that's because we're charging and discharging them maybe about once a week. So there are other medical device technologies in this area. So there's implantable pain control devices and other devices that work this way. I've picked a leader in this space, a group that already has a product on the market on charge energy transfer through the skin. So it's a very specialized technical area, but it's basically an engineering problem that's been solved. So I just need to customize it for our technology. Yeah.
And then when at the end of a life, you just replace it. I mean, how is that we're going to how you're thinking about it?
I'm not, I think the cells may need replacing before the battery needs replacing. My goal is to make the whole device last as long as possible while I work on partnerships with companies with cells and see how long their cells are working. The cell therapy people are looking for at least a 2 to 5 year lifetime for a product like this to be practical.
So you have to charge the actual device. Have you talked to or had conversations with end users on how that compares to, I guess, displacing current technology or drugs that they're using to treat type 1 diabetes?
Yeah, so our goal is to have them charge something once a week. And, right now, obviously, they're doing multiple things per day and they're changing out sensors on a weekly basis as well. So I think most people think this is going to be less burdensome. So the people that have had the implants with immune suppression, there was a Washington Post article, they were just raving about how it changed their life. They didn't know how much time they spent managing their type 1 diabetes. So yes, we have one residual maintenance, that's the charging of the battery, and it is necessary. So there will have to be alarms so the person for sure knows to recharge it, or they will lose their implant. But if you take immune suppression for a implant, for some other type of implant, if you don't take your immune suppression, you also lose your organ or your implant. So there is a little burden on the patient.
Thank you.
Thank you.